cholesterol reduction. We have diet modification. Okay, we've already talked about this. This is nothing new here. Eat breakfast, keep meals as low fat as possible. Always have multiple vegetables and fruits, and meat portions. You should have a decrease in the amount of meat that you eat, because it's that saturated fat that comes in those meats, and more the red meat, that is the problem that our body doesn't deal well with, that we cling on to that, our liver holds on to that saturated fat, and that helps with our increase in cholesterol. Spreads, of course, like butters and sauces and all of those desserts, your muffins, your donuts, and ice cream, highest levels of cholesterol. Not just your meat. Your red meat's actually below that. If you Google foods with high cholesterol, you're going to find donuts and sweet things like that, bakery items, and ice cream have the highest. Well, it's summertime. It's really hard to not have ice cream. That's when we all want it. However, there are other choices that are low cholesterol, and they taste just as good. I promise you, because that's what I eat. I'm shocked by it. I actually eat soy ice cream, and you can find it in the grocery store, obviously in the freezer section, and it tastes awesome. Awesome. So don't think that eating healthy has to taste bad, because it's not. It doesn't, and I can attest to that. Okay, so these are things that you may do as a nurse, which would be write a nutritional prescription. Obviously, your patient comes in, has high cholesterol, and you're giving them lots of education. One of the hard things to tell them is, you can't eat that anymore. Well, right. If you tell them they have to stop what they're eating and quit the diet that they're currently on, cold turkey, it's not going to happen. It's just like they're not going to be successful just quitting smoking cold turkey. Okay? So we have to give them attainable goals. So how about you decrease the amount? You don't eat hamburgers every day. You don't eat hot dogs every day. You don't eat red meat every day. Maybe you increase the amount of, if you need animal fat, maybe you increase the amount of fish, okay? Healthy fats versus your saturated fats. Maybe instead of eating margarine, look for natural butters or low cholesterol butters. All you have to do is read a label, okay? And you can get that, what's it called? Oh my gosh, I can't believe it's butter or whatever it is. If you, it tastes good, it's salty, it tastes like butter, it's yummy, it's spreadable. But if you turn over and look at the label compared to your Land O'Lakes real butter, you're going to see the difference in cholesterol. Everything has a number for cholesterol on it. So please, if you're talking to your patients, tell them, start reading labels. Don't guess. Don't read the front of the box that says this has low cholesterol, and actually turn it over, because a lot of that is marketing devices, okay, that get us to buy the products. When you turn over and read the label and actually see what's actually in it, you would be surprised. So make sure they have attainable goals. Do it in a stepwise fashion. Maybe it's just eat some more spinach. How about exercise a little bit more, so that, start walking, so that maybe you can increase your HDL. That helps get rid of a lot of those fats, okay? Don't tell them, like it says there, don't give them a list of no-nos. Oh, you can't have ice cream. Well, everything in moderation. You shouldn't have ice cream every day. My sister's dad had ice cream every single day. I just got done telling you how high in cholesterol it is. So maybe once a week. If you have to have it, that's a decrease, okay? Eliminate customary foods. Expect or suggest, don't expect a perfect diet. That's not going to happen, okay? If there's a food that you are used to eating all the time, you can't just eliminate it. If it's something that is a cultural thing, I'm Hispanic. We eat chorizo and huevos rancheros, and we eat tamales, and we eat tortillas. Somebody told me I couldn't have some of those things. Cold turkey, I don't know that I would be able to do that. Okay, gradual steps. So don't give them ultimatums. All right, I already mentioned exercise. Please, exercise is a great one. Anti-lipemics, okay, those are your cholesterol lowering drugs. Okay, so we see there, it lowers cholesterol, it lowers triglycerides. These are your anti-lipemics. You are going to need to know these type of medications, okay? So, with that being said, the first one that we're going to talk about is your HMG-CoA reductase inhibitors. It's a mouthful, but if you just say HMG-CoA reductase, I'll know what you're talking about, okay? It is your statins. That group when we need to know when we're talking about beta blockers, when we're talking about calcium channel blockers, these are statins. Okay, Lipitor, well that is a bad misspelling there. All right, Zocor, statins. Okay, you see that there? These are the first line of choice for hypercholesteremia. All right, so high cholesterol in the blood, this is your first choice. There are some side effects, so you need to know what those side effects are. You need to tell your patient you're going to be on this. You may see this, you may not. Again, take them with this type of food. Take them with a full belly, so maybe it decreases your chance of those side effects. Okay? These statins will decrease the rate of which cholesterol is produced by the liver. Okay? Liver produces those fats. Okay? Those lipoproteins. This is where it works. Okay? So what is HMG? What is an HMG-CoA reductase inhibitor? Oh, those are statins like Lipitor and Zocor, and they decrease the rate of production, or they decrease the rate of cholesterol production by the liver. Okay, so what are some of the things we want to watch for? One, I want to know what my labs are. Have we done any recently? Have they had any done recently? They may have, but they may have been on a statin for a long time, so they're not required to get labs but every once a year. So I would recommend that you go back in their history, in their labs, and review them. Do you see any history of these type of labs? Okay. We're going to go ahead and give it. I want to know when might you, because there are some side effects, so when's the best time to give these meds? Okay, these are things you might be asked that you need to know. Okay. Typical, one of the why a lot of guys or women don't like to take it is it causes GI upset. Okay, you're getting rid of that fat, you're kind of pooping it out pretty much. So you could have diarrhea. All right, so a lot of the times they don't like that, and so they don't want to take them. Why? I think that's a dumb reason. To me, that would be like, oh, that's awesome. I'm getting rid of all that fat. Okay, not a reason to take that medication. We want to be healthier, but if you're going to have a high cholesterol, this is one of those medications that you can take. Okay. There are some other ones. There are this bile acid. It is Questrin. I have not seen a whole lot of this used. However, it works primarily by preventing the absorption of the bile acids in the intestines. Okay. So it is definitely, it just prevents reabsorption of bile acids into the intestines. These acids then are released into our stool, our fecal matter, and we poop it out. So it can work fairly quickly. It's not the first line of drug. Our statins are. But this may be one, if we have really bad side effects with the others, that we could take. Okay? Triglyceride lowering agents. I do see these. Lopid. I see that quite a bit, actually. All right? So we definitely see that, and you'll want to know about it. It activates a lipoprotein lipase, which breaks down the cholesterol. So it also, which is nice, it also inhibits the production or the synthesis of triglycerides in the liver. Okay? This is probably one of the most common triglyceride lowering drug. This one didn't say it did it, nor did the statins. This one did. So if our triglycerides are up and we want to lower them, this is the drug of choice. Okay? does not allow triglycerides to be produced in the liver. Excuse me. We've heard this. There's commercials out there about Zetia. Okay? Zetia works differently than most other cholesterol-lowering drugs. It inhibits the absorption of cholesterol into the small intestine. Okay? So you'll want to know that. Niacin is another one. Lots of people take this. It is vitamin B3. It can be over the counter. A lot of your naturopaths will try this first. Okay? It inhibits lipolysis in adipose tissue and can increase the activity of lipoprotein lipase. All right? It lowers your lipid levels, so your serum cholesterol, your triglycerides, your LDL. Omega-3, we talked about that briefly. Omega-3 fatty acids. Latest research really kind of shows insignificant results with lowering this. However, it is still considered cardioprotective. Lots of people take this. I do as well.